and also the subgluteal. Okay, I think most of us are very familiar with the transgluteal, subgluteal, isn't it? That would be the, I think most of us being exposed earlier. All right, I think if you remember that, if you do your blind technique, definitely you will start learning about Labat, classical Labat method. That will be the most easiest structure, anatomy landmark that you can do. And anyhow, if you do a subgluteal, of course you need your landmark, the greater trog and ischial tuberosity. And if you do your parasacral, the landmark is also the greater trog and up to your posterior SIS. Okay, all right. So for femoral, definitely you need the wider probe because the structure is down deep. So you need a good penetration, because if you use your linear probe, definitely you can't see anything. All right, you can see only up to the 4 or 6 cm because the structure goes down until 10 cm down deep. And your volunteer today is also, you can see that it's quite thick. It's not easy to do a scan. So we did a lot of scan, but sometimes we can show you, sometimes a certain group we couldn't see the sciatic nerve. That would be the most challenging part. Anyhow, I think how to handle the probe is also important. How to move your probe is also very important, because ultrasound is operator dependent. So whatever you do, it depends on you. So the more you do, definitely the more expert you are. All right. So this is only a scout scan. All right. It is not about the how to deliver your drugs or how to deliver your needles. It's going to be another challenge. Okay. All right. So Prof. Sakura will start with the subgluteal. All right. All right. Okay. Last. I think our candidate is also very tired. All right. Sorry.
First, you need to find out where the orientation on there, and then where the trochanter, where the trochanter is, and then start looking.
Excuse me. It's my
Okay. Now you see the greater trochanter on the right, in the middle. Okay. Then move the transducer immediately, gradually, not suddenly, gradually move the transducer while trying to find another bony structure that is another landmark is ischial tuberosity. So luckily we have two structures together on the same image. Where is the other one? Greater trochanter. Where is the greater trochanter here? And
Your ischial
tuberosity is very around here. So there should be nerve in between two.
Supposed to be.
Yeah, here's the nerve, here's the bone, but yeah. Luckily, you have two bony structures on the same image, same view.
It's good to bring together.
Oh, yeah. Sometimes you do, yeah. Sometimes you can't. Here, probably here. Yeah, there are two bony structures on the same view, and the next thing you should do is look for the nerve. The nerve is always in between the two bony structures, and then you need to make a subtle adjustment of the probe by tilting or sliding, and looking for the nerve. And the nerve is right in the. For some reason, this is triangular stuff. That triangular or hyperechoic structure. That is the nerve. But if you're not sure that it's a nerve, you can always, slide. You check the nerve by sliding the probe or turning the probe by 90 degrees, like this. Okay.
So changing the axis.
Axis from short to longitudinal view. Oh, I'm not. Yeah, it's. Sometimes I have hard time.
This one, bro.
See, this one is a longitudinal view of the nerve,
Okay.
but that's not impressive right now, for some reason.
Previous
For
view
some
is
reason,
okay.
yeah. Yeah, probably. Okay. Okay. Can you accept this?
Is it okay?
Okay. Only this. Oh, here. Here is better. Here is better. Here is better. Okay. Sometimes subtle differences makes a big difference.
You
Okay.
can see the fibers inside.
Okay. Then when you come back here, and while seeing the hyperechoic sciatic nerve in a short axis view, I insert a needle. From
description, they call
from
it
lateral
the
to
hammer sign.
medial.
They try to find the sample sign.
Okay. Then let's see how the other approach should do. This is okay. Parasacral. Okay. First, you need to find out where the great trochanter is and the PSIS is. On the line, at the midpoint, you always, this is the starting point. On the midpoint on the line between these two. What you should do is just find the bony structure, continuous hypoechoic line, that is a iliac bone, white with shadow behind it, and on which there are two muscles, gluteal maximus and gluteus medius, okay, down. And then from here, I move the transducer inferiorly. Inferiorly. Yeah, here. Just, just, okay. To see, for some reason, sometimes, okay. So sometimes,
You can see the nerve coming out from the foramen.
yeah. You must see the gap. You must see the gap. Bone. Laterally, if I go that laterally, you only see the bone. But when you go medially, you can see the gap. That is the sciatic notch, and from which the sciatic nerve is coming out. Okay.
So this is your caudate. And
Okay.
This is Catholic.
Now you are seeing the longitudinal view of the nerve. Okay.
So the nerve
See.
is coming down.
Coming down this way. Coming down this way. So I'm seeing the nerve. Right on the nerve. Okay. Then could you turn on the karadoka here? But the one thing you have to keep in mind is that there's a artery running immediately medial to the sciatic nerve. So if I go medially, I always find there, this artery that is inferior gluteal artery. So if I see this, I'm too medial. So I go back laterally until there's another vein, okay, until the artery disappears. So yeah. Okay, I go back laterally until the artery disappears.
This is the nerve.
Oh, this is the nerve. Okay. So the insertion point is separate edge of the transducer, and is advanced in a separate caudal direction to touch the posterior surface of the sciatic nerve, and start injecting, and to see if you see the spread, right on the surface of the sciatic nerve, you can be very happy. But if you want, make sure that to have the small, very fast onset, you need to have the solution encircling the sciatic nerve, so that in that case, also you can see the transverse, short axis view, transverse image of the Left hand side is the medial side, and the right hand side is the lateral side. So that the left hand bony structure is the sacrum. Sacrum. The right hand side is the ischium. Right. This one. This is ischium. The left hand side is sacrum. Yeah. So this is the gap. These are great sciatic foramen. Okay. Okay. When I go this separately, only you see the bone surface, and then go distally, I mean caudally, you see the gap, and in the gap you see some. It's difficult, but here there's a semi-hyperechoic, structures. That is a nerve probably, but when you after injecting a small amount of local anesthetic here, the nerve can come out very vividly because the contrast between the nerve and the solution. Okay. Okay. That's how you check the spread of solution as well. But you can start from here to use this view to block the nerve. So in that case, you insert a needle from here, lateral to medial direction. Okay. In either way, you can block the nerve very easily. It's easier. It's easier than you think, than you thought. It works very well.
Hopefully it's easier. Come, let's try. Let's try. Come. You have to try and wait.
Your
favorite.
Easy.
So I try to view the shoulder axis. So which one do you
You
want?
want to do subgluteal? You can start subgluteal.
So if your dominant hand is right, you use the left hand. Which one do you use to put the needle in? Okay. Okay. So you need to grab this way, and have the other fingers to stabilize there.
So now I'm looking for the bones.
Yeah, there's a bone.
Okay.
There's a bone here. Okay. Then go medially.
2 fingers. Yes.
Okay. Then go medially to find out. Wow. Too slippery. Okay. This is the bone. Then come medially to find another bone. In that case, probably.
Is that a bone?
Could you increase one centimeter? Okay. Okay. It's difficult. Stabilize it. Okay. Stabilize it. Then try to find another bone. Where's the bone? Where's the bone?
One part is there.
One part is here.
One part
Is here, and the other bone is here. Maybe now it's too deep. I'm a little bit decreased. Could you decrease the depth, please? Could you decrease the depth, please? Okay. Now, in the middle, maybe pressure is not enough. Oh, there's no, right. Wow, accidentally. Accidentally you saw the name.
Alright, now you have
Then
to
you can turn the
long axis.
turn the long axis, but while not changing the position.
Don't change too much from the proper because you need to maintain your hot spot, the spot that you pointed.
Oh, you're good. A little bit more.
This one.
Little bit more.
Okay, you stop there and then just tilt your probe. And then you go side to
yeah,
side.
yeah. Okay. Wow.
You don't need to move anymore. Just still your probe and then you just still.
She found it.
Yeah, still. You can move, coordinate, and calculate.
Maybe a little bit more. No, not that. Maybe
This way, right?
this is the best view you could get.
Another tilt.
No.
More tilt.
Okay.
I think that's it. Okay, I think I'll be happy with this and not. Thank you. There you go.
Exactly.
First, you need to find the bony structure. Oh, in the middle. Okay, here has bone structure. Okay, then keep coming.
Okay.
This is the bone.
Yeah.
This is the bone, right?
A bit up.
Yeah. Here's the bone. Here's the bone.
Go back to lateral. There.
Yeah. Here, this is the greater trochanter.
Yes.
So in between, it's a little bit harder, but there's
The skill is not being seen yet.
Okay.
So a little bit more medial and then
here.
okay.
Okay.
Lateral.
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 Yeah, there's one.
Yeah, barely see the. For some reason,
It goes and comes.
There. Triangle is there.
okay, there should be nerve right in the middle.
Okay. Okay.
Okay, maybe you can turn and then change to your long axis.
It's kind of awkward to be using left hand.
Okay. Okay, now.
This way. This way.
This way, yeah,
okay.
two medium.
Okay.
Two medium.
There.
Oh, so you see
Yes.
the nerve.
Yes.
Wow, difficult.
Yes. I do.
You want to do this again?
I'll try.
Okay. We need gel, more gel. Thank you. So you're right-handed, right?
Yes.
So you need to hold the probe with your left hand, a non-dominant hand, and okay,
Okay.
this way. Okay. Then you stand more here because you want to insert the needle from here. Okay. First thing you need to do is look for the artery. Bone. Then, yeah. Then gradually move down.
Infero.
Okay. You now see the gap here.
Yeah. Yes.
You can come back. You can go back, and then see.
That's the one, right? Yeah.
Yeah. Now you see the. You can see the nerve more clearly if you try.
Look around.
Yeah. Just
Okay.
okay.
If you go down further medial,
Go medial. Oh,
Medial,
go.
Okay.
Okay, go down. Go down. Go down. Oh yeah, so you
Yeah.
see the artery.
Artery, yes.
Then you need to come back,
Up.
slide parallelly, make a parallel movement. Okay.
Okay.
That's a little bit lateral. Too lateral. Here.
Okay.
Okay. So you insert the needle from here.
Oh, okay.
Come here. Okay. So can you tilt to the
Yeah, tilt here.
Can you see the thin line here?
Yes.
This is the peritoneum.
Okay.
So don't go down deep into the foramen. Okay. So two structure to be careful. Artery and okay. So I know the position is not conducive for you because you need to bend. It is it's not appropriate for you.
Maybe you need a chair,
Yes.
or you need a patient high up. Okay.
So I think that is also important for you to make sure that your side is comfortable before you perform. Because it's very tiring. Okay.
Okay. Thank you very much for coming.